Hi, Dr. James here. I'm a board certified chiropractic neurologist and I've been in practice for over 30 years. And I want to talk to you today and hopefully clarify some of the confusion around disc bulges versus disc herniations. Because patients come into us all the time and they go, do I have a bulge or do I have a herniation? Or do I have a rupture? Or do I have a sequestration? Or do I have an extrusion? Or do I have a prolapse? Or do I have a protrusion? There are so many different names. So let's spend a couple of minutes and I think I can make this pretty simple and pretty clear for you pretty quickly for you, okay? So let's think about a disc bulge first. So when the spine gets compressed, you have to understand that these discs are basically designed as shock absorbers between the different vertebrae. So think of it like this. If you had a balloon between your hands and you were to squeeze that balloon together, what's going to happen to the balloon? It's obviously going to bulge out on either side. It's essentially what happens with a disc bulge is that you get a ballooning out of the disc material. Now the problem with that is the front border of the spinal canal that protects our spinal cord is bordered by the disc. So if a disc bulges, it can be broad and it can basically push into the spinal canal in the area where the nerve roots actually leave the spine. So it can compress the nerve roots as they leave the spine. If it's in your low back, and get pain down into both of your legs, or if it's in your neck, and get pain that goes into your arms. Disc bulges tend to be broader and they tend to be more symmetrical, but there's no golden rule that they're always like that. So that's a disc bulge. Disc herniations have several different subsets. So think of a disc really more, the anatomy of a disc is much more like a jelly donut. It's got a gel-like center and it's contained by concentric bands of fibrous tissue running at angles against each other. And what can happen is as the disc begins to weaken over time, that gel material can begin to stick out. So imagine you had a jelly donut on your table and you push down on the jelly donut, the gel would begin to basically push out. That's called a disc protrusion as the gel just essentially sticks straight out. Now, if the gel material begins to drop down behind the donut or behind the vertebra or goes to the side or it even goes up against gravity, we call that a disc extrusion. So the distinction is really one of tissue damage. There's more material going out and is dripping down or going side to side. So if you see a measurement on your MRI that says A to P, meaning front to back and transverse side to side, you know that you have a disc extrusion. So that's a protrusion and extrusion. These are subsets of a type of disc herniation. The last type is typically what we call a disc sequestration or sequestered fragment. So you can have a protruded piece or an extruded piece of the disc material break off from its attachment to the nucleus and be a free-floating fragment either in the spinal canal or in the neuroforamen where the nerves exit. And that's called a sequestered fragment. Those are basically the three subsets. Now the terms prolapse or ruptured disc typically mean the same thing, and depending upon the radiologist reading the film, you may hear different language. But a rupture we really understand to be a rupture of the annular fibers containing the disc material, the gel material, and that gel material is basically oozed out. So that would be a ruptured disc, or it could be a prolapsed disc. But essentially the three subsets are of a herniation or a protrusion, extrusion, and a sequestration. If the annulus is completely torn and the material is completely outside, we call that we can call that a prolapse or a rupture. And a disc bulge is, while it's less tissue damage, can actually cause as much, if not more, neurological issues for people. Now, there are many people walking around who have disc bulges and disc herniations, and they don't have any pain associated with it, which is why it's so critical if you're having pain with that you think is associated with a disc herniation or a disc bulge, or you've been diagnosed with stenosis or a prolapsed disc or sciatica, and then guess what? We need to evaluate you clinically and make sure that the clinical exam really matches what we see on an MRI. And we have a particular way of doing MRIs that we like to do in our office, and that's a weight-bearing MRI because it gives us much better clarity around what's going on with the disc in its weight-bearing position, since the job of our disc in our spine is to resist our body weight and gravity. So I hope this clarifies some of the names around disc herniations, disc bulges, and protrusions and things you may have read on your MRI report. And if you have any questions or you want us to evaluate you to see if we can help you avoid surgery and avoid more epidurals and avoid all the painkillers that you're taking and those mind-numbing drugs that you take and get you back into your life and help you function again, then please give us a call at the number below. We'd be more than happy to take a look at you, even do a complimentary MRI review to see if we can help you out. So I hope this is helpful, and I hope we can help you out.